Okay, so I'm not going to share the screen, but all the notes are on your Moodle page. But going through the homework, so a rickettsial disease um, is a disease that is a bacterial disease, but it is spread by ticks. And most often is the organism that, for number two, associated with Lyme's disease is Borrelia burgdorferi, and that is the common causative agent. So it is a bacteria. It is, now when we say a vector, so a vector is what is spreading the illness. Again, this isn't picked up in the water. This isn't picked up in the environment. It has to be spread via a tick. And the most common species is the Ixodes species that spreads this Lyme's disease. But Borrelia is what they're spreading when they bite. And again, when a vector bites, so, a mosquito is a vector, a tick is a vector, they're injecting, or basically via their bite, the organism is spread through the bloodstream. So that's how it enters the body and then goes through its stages. Now, what is a spirochete? So a spirochete is a type of bacteria. And again, when you get into Clin Lab 4 is when you really talk about bacteria. Now, bacteria have shapes. The most common are rods and cocci. So most bacteria, if they're a rod, it's shaped like a little rod. If it's cocci, it's circular. But spirochete isn't a common one that you find on when we're searching for skin bacteria and such. But the spirochete is in a spiral formation, and that is the type of bacteria, that is the shape or the classification for the bacteria that causes Lyme disease. It is a spirochete. And then list the clinical signs. So actually, maybe I will share the screen so you can actually see. So this was the handout on your Moodle page. So clinical signs, but remember, we can talk about the acute and we talk about the chronic, but the main disease is a shifting lameness. And remember in lecture, if they're lame from a true orthopedic issue, it's typically one limb. Like if they rupture a cruciate ligament in their right rear leg, clinical signs are in the right rear leg. If we're shifting lameness, then that's a diffuse lameness, and it causes achy joints. So they kind of just hurt everywhere. And so certain, they're going to be lame in maybe multiple joints, multiple limbs. Also, potentially, you can see actual swelling of the joints, potentially enlarged lymph nodes. Now, so polyarthritis, poly means many. Many joints are arthritic because whenever there's inflammation in a joint, inflammation decreases joint fluid. And then that means, synovial fluid is supposed to be sticky. And when inflammation dilutes it out, then you're getting kind of bone-on-bone movement, and you can actually see. Now, arthritic changes. When you take an x-ray of a joint, there are signs of arthritis. Now, that takes time to develop. So if this has been chronic, going on for a long time, you may be able to see radiographically arthritis. But if an animal is stiff or painful in a joint, sometimes they'll call it arthritic, even if there aren't, changes to the joint. But actually, so there's fever, enlarged lymph nodes, lethargy, depression, where they're lethargy and depression kind of go together. They don't want to play, they just want to sleep, and maybe they're actually not eating. And if it is allowed to progress into the chronic stage, it can actually progress into renal failure. And again, that's not seen in the early stages. That would be late stages. So that was number 5, is what are the clinical signs. What areas are considered endemic for Lyme's disease? Well, it tends to be more prevalent in the northeastern part of the US where this tick species is typically found. So it does have a northeastern, um, more of a prevalence there. So obviously, these clinical signs and this geography are going to point. And remember, I didn't ask a question on the homework about this, but in lecture, remember I said how important the history is. If you take a history and there's been hiking and camping, or the dog tends to go out in the woods a lot, because again, sometimes a tick is not found, and sometimes they're shaggy and you don't even see evidence of a bite. But if there's a history of hiking, camping, hunting, this dog has access to the woods, long grasses. Ticks like to live in long grasses. So if they're going in a little dog park and it's short grass and they live in an apartment and they're in the city, there's not going to be as much of a prevalent. Even if they're in the northeastern US, we kind of look at what does the dog do? What is its behaviors? What are normal activities? So that is kind of important. And it says number 7 is Lyme disease immediately transferred when bitten. So it's not transferred immediately. So the second line on the handout is the tick has to be on for at least 24 to 48 hours. So if they know that the dog went out on a Thursday and then she found the tick on a Saturday, that's been on for 48 hours. And obviously if the belly is really swollen and it's been on there. And I didn't ask a question about this, but it was when you remove the tick, you want to make sure you always grab at the head because you need to get the mouth out of the skin. So sometimes people grab just the butt of the tick, and when they pull it, they can leave the mouthpiece behind. So, and again, that can cause an infection later. So you always want to kind of grab at the head, try and pluck it out, and make sure you do get the mouth parts out. What diagnostic techniques do we use for Lyme's disease? So to diagnose, most vague clinical signs, CBC Chem UA, a lot of times are normal, maybe some slight inflammation on a CBC, but it can be normal with Lyme's disease. So probably the ELISA SNAP test or the Western blot test are going to be good. Now the ELISA test, which is the immunofluorescent assay test, that test can be positive if they've been vaccinated. So the Western blot is the test that can differentiate, are they vaccinated, are they not? And again, these are usually sent to the lab, so you're not maybe going to get instant results, but in a dog that's vaccinated, and again, vaccines aren't 100%, but you would want to maybe do that more advanced test. Now, treatment-wise, the number one treatment, because this is a bacteria, is antibiotic therapy. And the number one antibiotic is doxycycline. And so the cyclines, now, if they're young, you can try to use amoxicillin, because remember, doxycycline, tetracyclines, in young animals, it can discolor the enamel and affect the enamel of the teeth. So we don't usually, if they're young, we're going to have to probably choose a different antibiotic. But if they're, if they're over 6 months, they have their adult teeth, you're probably going to want to, choose a doxycycline. Doxycycline is the number one and most clinics carry it because a lot of the blood-borne pathogens, doxycycline is kind of a gold standard antibiotic. So the other thing that is not on here for treatment is usually because they're swollen and they're lame, sometimes you're going to use a regular anti-inflammatory, maybe not a steroid, but maybe like an NSAID like Rimadyl, potentially Tramadol, that may help with the pain. Now, as you treat the bacteria, the pain should start to resolve as well, but sometimes you can add a pain. But if I'm talking about actually treating the illness, that needs to be an antibiotic, and it needs to be doxycycline. How can we prevent it? So to prevent, there is a vaccine available. It's not, like I said, it's not usually recommended for every animal to get. It's not part of the core vaccines that every dog needs to get every year. But if you do have a client that camps, hunts, hikes, lives near the woods, dog has access to the woods, then usually we will recommend to get a Lyme's vaccine, because they have that history of those activities that put them in a more higher risk category, is what I'm trying to say. Now, Ehrlichia, it says, how can ehrlichiosis infection be diagnosed by looking at a smear? So when you look at a blood smear, and so Ehrlichia is a group, so there's different Ehrlichias, they tend to infect the white blood cell and form a morale. Now let me see if I can, actually, let me see if I can pull up this picture. Give me one, actually. So again, here is a picture of that morale formation inside a neutrophil right here. And that's what we're looking for. So it can be, again, diagnosed on a smear by just doing a regular CBC and look for that morale. So what is a morale? But it's a, so it's an inclusion in a white blood cell. It looks like a solid formed structure, so you could see it's, anytime something's in an inclusion, it's included or it's inside the cell. And again, normally in a neutrophil, you have the nucleus and you have cytoplasm. We don't expect to find inclusions. And you could see that solid mass kind of inside that white blood cell. And what is the scientific name for the brown dog tick? So this is the brown dog tick, actually Rhinocephalus sanguinis, but I want you to know just for the test, it can be spread by the brown dog tick. So that's fine to know for the test. And the Lone Star tick. But again, we're talking about ehrlichiosis kind of as a grouping of diseases. Now, if we're finding one of these, says what is the most common laboratory finding, is you can technically have, we're looking for a low white blood cell count. So because it can infect and destroy white blood cells, we're talking about leukopenia. So if you, now obviously some clinics do this. Most of the clinics I've worked at, if we had an abnormal CBC, you usually just do an automated CBC. And if the white cells come back as low, we usually would do a smear. Or if the red cells come back as abnormal, we do a smear. Because in automated counts, you can get a lot of errors based on certain diseases. So you can always back that up by looking at a smear. And then you would have your official diagnosis because you would see it. But you may find a leukopenia. Now, anytime an animal is leukopenic or you have low white blood cells, white blood cells fight various infections. So sometimes they may have they feel depressed, they have a fever, when they're fighting this and it's kind of consuming the white blood cells, other things are opportunistic. So, that kind of makes them feel down and out. And the Lone Star tick, don't worry about that. Actually, Americanum, Abelanium, these are hard to even say for us. Abelioma Americanum, but you got Lone Star America. Think of Lone Star Americanum. But like I said, for the test, I want you can just know as brown dog tick, Lone Star tick. That is fine. The 3DX test, the IDEX 3DX test, if I go down at the bottom of this handout, there's an IDEX 3DX and a 4DX. So 3DX is going to give you heartworm, Lyme, Ehrlichia. So if you suspect any of those diseases, it'll test for all three. The 4DX will do heartworm, Lyme, Ehrlichia, and the anaplasma. So it'll do all four. So the 3DX versus 4DX, obviously there's going to be a change in price, and it gives you an extra organism that you can test for. So they do have these extended SNAP tests. Which disease is the only intracellular disease that affects platelets? And that is anaplasma. So we kind of went over ehrlichiosis affects the white blood cells. Tetracycline is preferred, although you can also use doxycycline. Anaplasma causes a thrombocytopenia. So when we're talking about Ehrlichia, that can cause a leukopenia because it's infecting the white blood cells. Anaplasma is affecting the platelets and causes a thrombocytopenia. So when you have thrombocytopenia, that's affecting your thrombocytes, are your platelets, which help your blood clot. So anytime an animal has low platelets, they're going to be prone to microbleeds. Now that can be, I said it is rare to have, clinical signs. We're not typically talking about nosebleeds or, because clinical signs under here, it says minimal or no hemorrhage. When an animal has low platelets from like rat poison or mouse poison, we do look for like coughing up blood, nosebleed, blood in the urine. That causes more hemorrhage. In this case, you may see those petechia, the pinpoint hemorrhages under the skin that look like little micro bruises. I mean, sometimes they can look like a bigger bruise, but sometimes they look like little pinpoint, because then basically what happens is they bump into something, they break some little blood vessels under the skin, and they don't have enough platelets, and it causes some bleeding under the skin. So you can, they can be asymptomatic, a little bit of fever, but the big thing is the petechia, minimal hemorrhage from like the nasal cavity, coughing, urine itself. And then for 18, kind of as a summary, what is the drug of choice for rickettsial diseases? And that is always going to be doxycycline. Doxycycline, doxycycline, doxycycline. Now, cat scratch disease, I posted the handout. I'm probably not going to ask questions on this test because I didn't go over the handout in class. I'm probably going to move it over to infectious diseases. So don't worry about 19. And for 20, I'm also going to move the zoonotic ones over to the next test because we didn't specifically separately talk about zoonotic, even though that's part of the title of this section. I'm going to move it over into infectious diseases, so we'll kind of talk about that separate. Let me go ahead and open the other handout. Let's see. Right, I'm going to do Giardia and Coccidia right now. So good question. Okay, so Giardia, or giardiasis, is sometimes that is referred to. It says, what medication is often used to treat Giardia in dogs and in cats? In dogs, and this is what I specify, is we typically treat with metronidazole because it's a protozoal parasite. It doesn't produce a worm. We look for like these single cell kind of protozoal organisms. But I do want you to know it as metronidazole. The trade name is Flagyl, but metronidazole is the treatment of choice. In cats, you can actually use Fenbendazole. Now, the reason sometimes we don't use Metro in cats is it comes in 250 milligram and 500 milligram. There is a liquid form of metronidazole that is a lower milligram. It's like 62.5 milligrams. But if your clinic doesn't have that, you could always use Panacure, which is fenbendazole, and that'll treat it. But the gold choice is metronidazole. That's the primary treatment. Now, even though it's not a question, let me talk about a few things. Giardia is a protozoa. It has a trophozoite and a cyst. And what we're looking for is the frothy diarrhea, febrile. Sometimes they're vomiting if they're sick enough, but diarrhea and very kind of watery, frothy diarrhea. And the diarrhea is typically normal poop color. The reason I say that is parvo diarrhea can tend to look kind of gray and has a very foul smell. Giardia diarrhea, which is also watery, tends to look more like normal stool. Not that it smells great, but it's not like parvo. It's a different kind of smell. But what we're looking for is it's an oral fecal contamination, usually via standing water. So if the dog has been swimming in a pond, drinking from a puddle, drinking from like something outside that holds water, you know, it's going to, they ingest the cyst form, and that is in the intestine, and then the trophozoites attach to the intestinal wall, but then they shed the cyst. So typically when we look on a fecal, you're looking for the cyst. So if I look down here at the bottom of this handout, there's a cyst form, and here is a trophozoite. So it looks like it's got the face with the little kind of hands, but these are the one on the left is what usually attaches to the intestine, although sometimes they will shed those, but we're usually looking for the cyst formation. What I also want to highlight here, so the clinical sign, what we look for, the CBC a lot of times is normal, but the fecal exam, you can either see the cyst on a standard fecal float, or there is an ELISA test that is run on feces that you can send to the lab that's a little more sensitive. And what I will tell you is a lot of doctors, even if you do a negative fecal and the doctor is highly suspicious that Giardia, you can either run the ELISA test, but a lot of times they're going to put the dog on metronidazole and run a course. And if the dog gets better on metronidazole, then maybe it was Giardia. If the dog doesn't get better, then maybe it was something different. So sometimes we'll just treat sometimes with these parasites if we suspect, but we don't have a fecal confirmation. So you can do that. And usually we do recheck vaccines. Usually we do like a 2-3 week course and recheck a fecal to kind of make sure it's clear. Or sometimes the client's like, hey, they're all better. Maybe they don't want to do the fecal, but it's always good to recheck, make sure that those tests are negative. Now let me bring up Coccidia handout. Sorry, I was like, come on, computer, you were behaving. Now Coccidia, similar to Giardia, we're looking for a little protozoal cyst. Now this one tends to be the difference. Coccidia are a little bit smaller, so it does affect the intestine. It is Isospora in Asparaginus and Felis, and it does produce a watery mucus diarrhea. So Giardia diarrhea, Coccidia diarrhea can look very similar, although Coccidia are most often going to be seen in the younger patients. Giardia can be seen in all ages, obviously younger, but if your adult dog goes and drinks out of a pond and stuff, can get, Giardia. But it can cause severe dehydration. 22 says what medication treats Coccidia, And that's actually going to be Albon is the treatment, which is sulfamethoxine and Albon. But I do want you to know the trade name. AJ, what are you eating? I do, hang on, I don't want him to swallow this. Oh, dang it. Oh. It's his birthday today, and he thinks he can just play with. You want to say hi for your birthday? Come here. Come say hi. Come here. AJ, come here. Come on. Want to say hi? Come here. I'm on video. Come here. Okay, fine. You're not gonna. Yes, so he got into my daughter's room, and she had like this humidifier thing, and the top has like a little spout, and he was just chewing on that plastic. And I'm like, oh, you swallow that, that's definitely getting stuck in your stomach. So we're not having a gastrotomy for your birthday. He gets one day of being a bad boy. He's every day. Hey, Jade, come here, say hi. Come here. Oh, you just honked your head. Say hi. Wait, no, now you're burping in my face. Okay, that's fantastic. So here's an 80-pound birthday boy, right? Be good. Go be good, okay? Don't destroy things. Okay. Okay, so I want you to know it has Albon. The generic name is sulfamethoxine. It is a liquid, so it can be, so if we talk about the spreading, normally most of it is going to be spread via contamination, oral fecal contamination. And normally if we have it, if the puppies and kitties are going to get it, it's usually from in the environment. So transplacental is not a common form of it, of spreading. So sanitation is the number one, you know, and that's going to be, so they're usually going to get it. Oh, Morgan, I just saw what you said about the chocolate chips. That's funny, or not funny. So coccidia, that's not a common transfer. It's usually going to be, so we talk about the life cycle here. So it's going to be, you know, more in the puppies and kitties, more in the environment. And the thing is, the mother, in a lot of these, you know, why we see it in puppies and kitties, if the mother has it dormantly, and then when she is giving birth and she's somewhat immunosuppressed, and then she is shedding in the environment, and it is spreading environmentally, and that's kind of the more common way. So it's like, you know, and then what can happen is she picks it up because she licks them, and it kind of just keeps reinfecting. So a lot of times the mother can be treated as well as the puppies and the kittens. So we talked about, you know, it can be shed, they can be asymptomatic, they can have another disease, and if they have environmental stress, it can exacerbate the condition. It's going to be an infected oocyst, and then the sporocyst forms a sporozoite. And again, they penetrate that lining, and then they shed the cyst. So often we're looking for the coccidia cyst on a fecal exam. And you look for like a standard fecal float. Sometimes it can be seen on a fecal smear, but the fecal flotation is going to be the best way. So it said, I'm kind of jumping around, but 23 was what's the best method for Giardia is the fecal float. Coccidia is going to be a fecal float as well. Sometimes it can be seen on a smear. And then sanitation is always going to be the best to control. So to clean the environment, The cysts can be somewhat resistant. Um, so it's always going to be picking up the stool, cleaning where the stool has been. Now, there was a separate, sorry, I have to keep jumping out of this to open the other handouts. There was the toxoplasmosis information. Sorry, it's trying to, come on, PowerPoint. There you go. And so in toxoplasmosis, it says, how is it transmitted? Now, transmitted can be transplacental, fecal, oral, or contaminated meat. So those are the most common. The cat is the definitive host. And so these are the ones that are typically, can be transplacental or contaminated meat. So again, if you have a cat that's outdoors and they're hunting and eating mice and rodents, that's going to be one route. If they're eating raw meat, some people feed a raw diet, that could also be a route. That's why pregnant women, you're supposed to heat everything up. Now, there's not I could have put 5 million questions on this study guide, but the big thing that happens is that these cysts can form in the muscles. So as the toxoplasmosis travels through the tissues, they can form these cysts, and that's what causes some of the clinical signs. It can affect the ocular tissues. So you can get some uveitis, some photophobia, things of that nature. And then again, lethargy, anorexia, weight loss, fever. Now, respiratory distress and neurologic signs is if those cysts actually penetrate the nervous tissues, or sometimes they can form cysts in the lungs. And if they have enough cyst formation, then it can actually take up viable lung tissue, and they can show respiratory symptoms. Again, if you do a fecal and we're looking for the cyst formation, you've got sporulated. Spore is forming another one versus unsporulated. And then, the prevention, and there's going to be I always try to find what's the key stuff, especially if you're in a clinic, because pregnant women have to be very cautious, and I like to stress this on essay questions. What are you going to tell someone if they come in and they, first of all, they don't have to get rid of their cat, but because it is fecally, oral fecal, and can be aerosolized. As feces sits in a litter box and it becomes dry and they dig, could they potentially aerosolize that? So maybe, pregnant women, it's a good excuse to have someone else do the litter boxes, or wear a mask and wear gloves. And then gardening in garden beds, especially around the house, because outdoor cats sometimes like to defecate in garden beds. So, we usually say avoid gardening, avoid cleaning litter boxes, sandboxes, especially if you've got outdoor cats are like, oh, look at that big litter box, and it's a sandbox. So they have to be cautious, wash their hands, cook meat very, very thoroughly. The last question on there, which I didn't do a separate handout or talk about Babesia, but this affects the red blood cells. So Babesia can be an organism that can infect red blood cells. You see a little inclusion. So again, that can be diagnosed on a smear, but the test is going to primarily focus on the areas that we talked about in class that I've just gone through. So we've got coccidia, giardia, toxoplasmosis, are kind of our protozoal diseases. Now, I will say when an animal comes in, we're usually screening primarily with diarrhea. We're primarily screening for Giardia and Coccidia. But if you have an outdoor cat and you see some of these vague clinical signs, they can be screened for toxo. Then the treatment for toxoplasmosis, it kind of depends. I didn't go through the whole PowerPoint slide by slide. That PowerPoint is recorded on your Moodle if you need to rewatch it. But we said with toxo, some animals can be what we say, if an animal is subclinical, meaning they are not showing active signs of the illness. The illness is not reached a point where they're showing outward clinical signs. Now, obviously, the more clinical signs that an animal shows, it's going to be a little bit harder to treat toxo. So you can do supportive care, pain medications for the cysts. Clindamycin is going to be the treatment for toxoplasmosis. Again, it's an antibiotic. But if you're not seeing, if you have a cat and it's on medication for 2 weeks and there's no improvement in clinical signs, you can try to switch to a different antibiotic, but that is a more guarded prognosis, meaning maybe it's too advanced. Again, there was a note that it's not usually fatal, but this is usually something that it kind of depends on how far. And then a good prevention is also keep your cat indoors, because they're going to have less of a chance of, picking it up. Because again, mice and rats and moles and things out in the environment, for cats that hunt outside, they're at a higher risk for toxoplasmosis. What other questions do you have? I know I kind of went through those questions fairly quick, but I focus on, did I give you any key client education tips? We talked about cleaning environment. We talked about treating full course of the illness. Talked about common medications to treat, and which ones do we also need to, I guess, especially with toxoplasmosis, there are some key clinical or some key client education tips for owners, especially a pregnant, if they own a cat and they're pregnant. If it's indoor, they run less of a risk, but remember, animals can be subclinical. So if this cat had a history of at one point being an outdoor cat, I would still warn that owner to maybe not be doing the litter boxes. And obviously gardening and sandboxes, any stray outdoor cat can have access to those. But keeping your cat indoors, keeping things clean, litter box contact, raw meat for toxo are very, very key clinical tips. Okay, so anything else with toxo or the other two? Actually, let me